You probably know where to pump the cheapest gas, how to get price comparisons online in seconds for headphones or cars. But how would you find the best deal on an MRI or a knee replacement? You have no idea, right? And if you could, it'd be the magic fix for healthcare, right? Yeah, not so much. That's the topic of this week's Healthcare Triage. Special thanks to Austin Frakt, from whose Upshot column this episode was adapted. This lack of price transparency in healthcare has been cited as one of the reasons we spend too much on it. It's easy to overpay. Healthcare prices vary tremendously, and there's no established relationship with quality. In Los Angeles and San Francisco, one analysis found mammography prices could vary by over a factor of 5, from a low of $128 to almost $700 for the same thing. Prices for IUDs and lower back MRIs vary by a factor of 3. An examination of Massachusetts healthcare prices found nearly a 4-fold variation in MRI prices. Despite these differences, even patients motivated to find the lowest price often can't. That's changing. Over half the states have passed laws that either establish websites with healthcare prices or require plans, doctors, and hospitals to disclose them to patients. Some employers and other organizations also provide healthcare prices to employees and the public. But improved transparency isn't working as well as we might hope. Healthcare pricing apps and websites don't always help patients spend less. That's the conclusion from a study published this year in the Journal of the American Medical Association. It investigated the effect of the Truven Treatment Cost Calculator, a website available to more than 21 million workers and their family members. It provides users with the cost, both the total price and the portion the user will be responsible for, from over 300 services, including various sorts of imaging, outpatient operations, and physician visits. The researchers compared outpatient healthcare spending of about 150,000 employees who had access to the website with that of about 300,000 comparable employees who didn't. They didn't examine inpatient spending because it's dominated by non-elective procedures that really aren't amenable to shopping. Despite its features, the cost calculator was not popular. Though 60% of employees with access to it faced the deductible of over $500, only 10% used it in the first year of availability and 20% after 2 years. The study found that price transparency did not reduce outpatient spending, even among patients with higher deductibles or who faced higher healthcare costs because of illness. Study after study has showed the same thing. Health plans report that use of their price transparency tools is limited, with many enrollees unaware they even exist. The vast majority of plans now provide pricing information to enrollees, but only 2% of them look at it. Aetna offers a price transparency tool to 94% of its commercial market enrollees, but only 3.5% use it. One study found that only 1% of residents in New Hampshire used their state's healthcare price comparison website over a 3-year period. Another study found that use of the price transparency platform Castlight Health was associated with lower payments for lab tests, advanced imaging, and office visits. However, the study did not examine outpatient spending overall. Another reason people may not price shop for healthcare is that they could find the process too complex. Providing more information to consumers doesn't always improve their decision-making. In many settings, it can overwhelm a person and lead to poorer choices. It's far easier to go on a recommendation even if it costs more. And not every kind of healthcare is amenable to shopping. According to one analysis, only about 40% of spending on healthcare is. Patients can reasonably shop only for care that is for non-emergencies and will be motivated to do so only if they stood to gain. If patients' out-of-pocket costs are the same at both a high-cost and a low-cost doctor, what's to prompt them to select the cheaper one? Insurance pays for the difference anyway. Even consumers who use price comparison tools may select more expensive providers because they think higher healthcare prices imply higher quality, even if that's often not the case. Yet only half of price transparency tools offered by health plans include information about quality. One study found that including easy-to-understand quality information alongside prices helped patients select higher value care. But a 10-year study across 16 communities, funded by the Robert Wood Johnson Foundation and published in Health Services Research, found that newly available reports comparing the quality of care of physician practices and physician groups had only a modest effect on the awareness and use of this information. Only about 5% of chronically ill people reported that they considered such information when making care decisions, an increase from just above 3% a few years earlier, although this increase varied across communities. Changes to how health insurance works might improve the effectiveness of price transparency. For example, when an enrollee in a plan for California's retired public sector employees select a hip or knee replacement more expensive than a preset price, she pays the entire difference. The shopping that this motivates is credited with reducing hip and knee replacement prices by 20%. We did a whole episode on that. Direct outreach to patients to help them find services that cost less is another approach. One program used by commercial insurers targeted patients who had been referred to low-value M.R.I. providers, getting them to voluntarily switch to ones with lower prices, but adequate quality, and convenience save $220 per scan. If there's one thing we've learned time and again, it's that there's no single best way for reducing healthcare spending. Price transparency may be part of the answer, but it clearly isn't the entire answer. Healthcare Triage is supported in part by viewers like you through Patreon.com, a service that allows you to support the show through a monthly donation. Your support makes this show bigger and better. We'd especially like to thank our research associates Joe Sevitz and Jonathan Dunn, and of course our Surgeon Admiral Sam. Thanks Joe, Jonathan, and Sam. More information can be found at patreon.com/healthcaretriage.